Leslie, would you mind coming off mute, please?
Sorry, that was bound to happen. Good afternoon, everyone. My name is Leslie Richards, and I'm delighted to be hosting today's session on supporting the mental health and wellbeing of frontline workers. My role within CIPD is to head up the team in Wales, but please don't worry, this session is applicable to everyone wherever you're based, so don't let the accent fool you into thinking you're in the wrong place. So the purpose of today's session is to talk about the importance of mental health and well-being, which has become even more apparent during the past year, and which, if it wasn't already there, is firmly on the agenda as employers recognise the vital role that they play in supporting staff, both now and beyond the pandemic. We're going to be focusing on how to effectively support frontline and key workers, the role of occupational health in identifying and discussing appropriate interventions, and the need, more than ever, to develop and embrace a compassionate leadership culture to tackle the stigma around mental health. So today I'm joined by a panel of 3 experts, each of whom brings a different perspective to the discussion. First of all, Ben Willmott, who leads the CIPD's public policy team, which works to inform and shape debate, government policy and legislation in order to develop higher performance at work. Ben's got an incredible knowledge across a range of areas, but it's his interest in employee engagement and well-being and absence and stress management that are particularly relevant to today's topic. Dr. Gail Kinman is Visiting Professor of Occupational Health Psychology at Birkbeck, University of London. Gail has extensive experience in research and practice with a focus on improving the working conditions and well-being of people who do emotionally demanding work, such as health and social care professionals, prison officers and academics. And finally, Steve Lee, Head of Staff Health and Wellbeing at NHS England and NHS Improvement. Steve has a strong track record in implementing evidence-based measures to prevent mental health in the workplace, and in his current role is responsible for the delivery of the health and wellbeing offer to 1.3 million NHS staff across England. So thank you to our 3 panellists for joining us this afternoon. Before we hear from our speakers, I just want to cover some practical details. The session is being recorded and will be available on demand via the webinar section of the CIPD website, when you can access all our previous webinar recordings and sign up for future ones. All attendees have been muted. To submit questions to the panel, please type into the Q&A box and not the chat box, though you can use the chat box to network with fellow attendees. And please remember to use all panelists and attendees in order to share with everyone. I'd also like to draw your attention to our member benefits, and in particular, some of our additional resources you may already be aware of that can support you in your role. As we continue to navigate these unusual times, we're updating the FAQs and resources on our website all the time as information becomes available. So you need to go to the CIPD Coronavirus Hub for more resources which are available to all our CIPD members. We can also access individual legal advice via our HR Inform helpline, which is available 24/7. And finally, CIPD members in UK and Ireland can also access our new Wellbeing Hub and helpline. Together with award-winning workplace wellbeing provider Health Assured, we now provide CIPD members with free help and support 24/7, 365 days a year via telephone or online consultations with qualified therapists. Members can access the phone number and the online services via the membership benefits webpage, and you'll see more details about this at the end of the session. So now on to the content. Ben will be our first speaker, and he'll cover the CIPD perspective, giving a general overview of our theme for today, followed by Gail, who will look in more depth into the impact and wellbeing challenges for frontline workers, together with interventions that work. And finally, Steve, who'll bring the issue to life with a practical case study. We'll then open up for questions, so please send these through as we go along. We'll aim to get through as many as we can. We may not be able to focus on each individual question, but we will try to pick up themes and group them. So I think that's all from me for now. I'm going to hand over to Ben to get us started. Thanks, Ben.
Good afternoon, everybody. The issue of mental health of the workforce has grown in importance as a business issue in recent years, as knowledge on the subject has increased, highlighting the risks to both workers and organisations if not addressed. And concerns over the issue in stress and in common mental health conditions like anxiety and depression has reached across the workforce and become even more of a focus as a result of the pandemic. And as I'll outline in my presentation, there are particular risks for frontline and key workers. Next slide, please. The cost and impact of mental health at work was most recently put into context by the Stevenson Farmer Review of Mental Health. This estimated that the cost of mental health illness per employee per year was between about £1,200 and about £1,500 per year per employee, and the costs made up of a combination of absenteeism, presenteeism, and staff turnover. But there are some other wider issues, I think, around the cost of mental health as well, which maybe we'll touch on as we continue the discussion. Next slide, please. This is a slide from our recent April 2021 Health and Wellbeing survey, and what it shows is that mental ill health is the #1 cause of absence, with stress in it, long-term absence, with stress in it at #3. But it's also stress and mental ill health are both a significant cause of short-term absence as well. And also, I think it's highly likely that a significant proportion of reported minor illnesses actually hide issues around stress and mental ill health as well. So it is a significant cause of absence and has to be managed effectively. Next slide, please. The Health and Wellbeing survey also highlights that presenteeism is becoming more of an issue. So this year, 3/4 of employers said that they were aware of presenteeism in their organisation, with both people who are continuing to work in going to the workplace and amongst home workers. Next slide, please. We've also seen an impact, not surprisingly, on people's well-being as a result of the pandemic. And this slide shows data from September 2020. This is employee survey data, which shows how the pandemic has had a negative impact on people's well-being in a number of different ways. But if we look at mental health, 45% of the 2,000 employees sampled said that their mental health had got worse as a result of the COVID-19 lockdown. So the pandemic has undoubtedly exacerbated existing issues around health and well-being, and particularly around mental health. Next slide, please. I think the other, and particularly relevant to this discussion, is that there are particular factors that can undermine the mental well-being of frontline workers. So we know that, of course, anyway, interaction with customers, patients, and members of the public can be challenging. Create some really emotionally difficult situations, and those interactions have only been exacerbated by the pandemic. We know that frontline workers also typically have less access to flexible working, including home working, and of course flexible working can help people manage issues they may be having to deal with outside work, improve people's work-life balance, manage caring responsibilities, so really critical to supporting people's health and well-being. The other issue is around autonomy. Because of the nature of frontline workers' jobs, quite often they have less control over their work or their workload. And there are also additional potential challenges around low pay, with for some frontline workers more likely to suffer from low pay and to run into issues around sort of their financial well-being issues with debt, for example. And finally, the issue of antisocial or long hours working, which can cause additional stress, impact on people's abilities to make healthy lifestyle choices, impact on people's sleep patterns, etc. So there are some real risks, particularly for frontline workers around mental ill health, which have been exacerbated by the pandemic. Next slide, please. Now, managing and preventing stress is critical to an approach to trying to supporting the health and well-being of staff. The Health and Safety Executive defines stress as the adverse reaction people have to excessive pressure or other types of demand placed upon them. Now, we know that there's nothing wrong with short bursts of stress or pressure, or typically there isn't, but it's when stress becomes continuous or excessive pressure becomes continuous and unrelenting, or a chronic stress, that this is linked to higher risk of conditions such as anxiety and depression, as well as heart disease. We know that stress can also have a significant impact on people's performance and how they interact with colleagues in the workplace. Stress impairs or can impair people's cognitive ability and undermine their judgment, their ability to prioritize. And research from the HSE leads to behavior that can increase the likelihood of mistakes and accidents. So for frontline staff, managing stress is absolutely critical to supporting their health and well-being, and also to making sure that issues around customer and patient care are taken into full account. Next slide, please. This slide highlights the sort of major cause of stress at work, as according to our Health and Wellbeing at Work survey. There are some particular causes of stress coming from the pandemic. So you'll see that that COVID-related anxiety because of fear of contagion in the workplace is identified as a stress for this year's survey, as is new work-related demands or challenges down to home working as a result of COVID-19. But the top two causes of stress remain workload and management style, as they have done for the last few years. And we know management style in particular is critical. It can help to mitigate issues around workload, but also some of the other issues around how people are able to deal with non-work issues, how they are able to manage caring responsibilities, for example. So that issue of management capability is critical. Next slide, please. Now, the CIPD has conducted significant research over the last few years, looking at the management behaviours that underpin employee engagement, but also support health and well-being in the workplace. And this has led to the development of our competency framework, identify 5 competency areas which are critical to trust, engagement, and a positive psychological contract. First area is around sort of being open, fair, and consistent. So managers, managing their emotions, not passing on stress. The second area is around handling conflict and people management issues. So managers being able to have the confidence to intervene at an early stage, for example, if there's conflict, knowing when to use informal approaches, but also when they need to use the formal processes, using that judgment in those sorts of situations. They need to be able to provide knowledge, clarity, and guidance, so providing constructive feedback, real clarity over objectives, joint problem solving, and building and sustaining relationships is absolutely critical. So do they really know their staff? Do they understand the issues that matter to them? Do they demonstrate that they care about them? This is about really the essence of building trust. If people don't trust you, they won't disclose if they have an issue or challenge. So unless you get these behaviours right, then anything else you do to support the health and well-being of your staff is building on sand. The final area is around supporting development. So, do managers ensure, do they coach staff? Do they ensure they have access to training? Do they support their progression opportunities? So these are the sort of the foundation from the CIPD's perspective around health and wellbeing. Next slide, please. But no matter how well people are managed, employees will suffer from mental health. And it's crucial that managers are also able to spot the early signs that might demonstrate that people have an issue. This quote is taken from our joint guide with Mind around managing, supporting mental health in the workplace. And I'll touch a bit more on these issues. Next slide, please. We'll miss this one because of time. So managers need to be able to pick up the signs of poor mental health. And these might be people working long hours, not taking breaks, but it might be, people being late, leaving early, taking extended lunches. It can be, people taking time off, or conversely, it might be not taking time off. It's about, what are uncharacteristic changes in emotional response? So are people, reacting differently? Are they moody? Are they, showing differences in how they respond? Is there impairment or inconsistent performance, or out of conflict with colleagues? All of these might be indicators that all is not well, and managers need to be able to have those open conversations that can help get under the skin of these issues. Next slide, please. And so besides that investment in people management capability, then it's important that you have the right support and practices available. And these are some of the key ones that we know make a difference in terms of supporting employees with mental health difficulties. I'm conscious I'm running out of time a bit, so I will move on to the next slide. I'll just pick out the last couple of findings on this slide. This is data from our health and wellbeing survey, and it shows how employers rate the effectiveness of promoting, supporting positive mental health in the workplace. And I think the worrying sign is that the bottom two findings around managers are confident to have sensitive discussions and signpost staff to expert sources. So just 38% of employers said their managers were confident in that respect. And just 31% says managers are confident and competent to spot the early warning signs of mental ill health. So even though these issues, there has been some improvement over the last few years, it's still a minority of organisations that are saying that managers have competence in these key areas. Next slide, please. And finally, I'll just leave you with this slide. There is a very, very strong business case for investing in the health and well-being of your workforce, and it's critical that this is really fully factored in when the case for investment in manager training and access to occupational health and other support is made to organisations. I'll leave it there. Leslie, I'm happy to take questions later. Thank you.
Great, thank you, Ben. Just moving on to Gail now, who's going to look a bit more in depth at some of the issues and interventions. Thanks, Gail.
Hi, everybody, and thanks very much for inviting me to give this contribution to your really interesting webinar. Okay, so I'm going to be just talking a little bit about supporting the mental well-being of frontline workers, and this is drawing on quite a lot of research I've done myself, but also a resource as part of a series of resources that I've been commissioned to write for the Society of Occupational Medicine and Public Health England. So next slide, please. Well, I'm sure you'll all agree, we are experiencing a situation of unprecedented demand, very, very challenging times. We know that workers are experiencing considerable difficulties from many different sources, concerns about their safety, their job security, etc. Many changes in work practices and locations, and also, and I think this shouldn't be underestimated, considerable uncertainty about the future. And unsurprisingly, as Ben just said, there has been high levels of mental health problems observed in many different surveys, depression, anxiety, and also loneliness. And that can be a particular issue for people working at home. And people with existing mental health problems, as Ben mentioned, that often has exacerbated these existing issues. Now, we know that there different groups of workers have been disproportionately affected. And certainly in the work I've been doing recently, there is evidence that younger workers in particular are having particular problems. Workers from BAME backgrounds, workers with disabilities, but also those doing particular types of work. So it's no great surprise, I guess, that health and social care workers are considered to be at high risk, but we also need to acknowledge the difficulties that other groups of workers are facing, such as security guards, drivers in general, cleaners, etc. But today I'm going to be talking about healthcare professionals. So research, sorry, next slide. Sorry about that. Research certainly shows that during the pandemic, the workload, working hours have increased for healthcare workers. And certainly reviews of the evidence that I've been commissioned to conduct over the last couple of years on the mental health and well-being of UK doctors, nurses, and midwives show that this was poor prior to the pandemic in general. So they were at considerably high risk of burnout, mental health problems, etc., in relation to their work. But it has deteriorated during the current crisis. Now, we've got longer hours, etc., evidence for higher intensity of the job, fewer breaks, difficulty taking time off, etc. Now, unsurprisingly, it's left the workforce in general exhausted and feeling depleted. And they now have to face a whole raft of other demands to catch up with the workload that has remained undone during the pandemic. So also other issues that we found: discomfort and fatigue from long shifts spent wearing PPE, and obviously wearing PPE has interfered with communication with patients, etc., and service users. And also many many staff have moved from a face-to-face service to a predominantly virtual service. And, you know, we shouldn't forget the needs of those, because it's very, very difficult talking about challenging and personal issues to vulnerable people online. So it's important to acknowledge that. We know that burnout is certainly a key concern, but, you know, there is a high risk of stress, depression, and anxiety. Research conducted recently, particularly by Neil Greenberg from King's, has found that the scope for PTSD has increased. Also a tendency perhaps towards problem drinking, where people are using substances as a form of self-medication to manage their stress and their mental health. But I think what's particularly interesting, and this is something that we should all be on the lookout for, you know, when managing people, is something called moral injury. And this may not be something that everybody has come across, but it's really interesting, and it's where people feel obliged to act in ways that violate their ethical and their moral code. And I think in health and social care, this has happened, and it can be a very extreme source of distress, increase the risk of PTSD, anxiety, and etc. And there are some interventions that can be put in place, but obviously the stigma can be a particular problem, so people should be encouraged to speak up about this. Compassion fatigue is also another issue that's linked with PTSD and burnout, and this is something where, you know, basically what it says on the tin, it's where people are unable to process all of the emotional demands that they experience. So they tend to get a bit emotionally blunted and cynical, and may depersonalize their recipients of care. There has been COVID-related stress also experienced by people working in healthcare, because obviously the concerns for their own health and their family's health and safety have to be balanced with their, you know, demands for and their wish to treat other people and put themselves in harm's way often. And there's also some evidence that financial insecurity can be a concern for people at the lower levels in organisations, particularly hourly paid staff. There has been an increased demand from counselling and support. certainly the use of the BMA's mental health helpline rose by 80% fairly early on in the pandemic, which suggests that people are very much looking for support. But often people may have problems accessing support because perhaps they may not know where to go. Information can be dispersed very widely, so it's quite difficult sometimes to find out where you can access support, and they may have no time or feel that they lack time to enable them to access support. Now, as we know, experiencing job-related stress, burnout, and mental health difficulties can lead to impaired performance, and this can have very severe implications for patient care in terms of perhaps error making, etc., and also patient satisfaction, where the rapport that staff can have with patients sometimes can suffer. There is high sickness absence, and certainly the scope for sickness presenteeism in healthcare is much higher. Quite a lot of the evidence, certainly reviews that I've conducted in this particular topic, suggests that presenteeism can be a very major problem for lots of different reasons. High workload, also low staffing, where people may not have cover, perhaps when they're off sick. A sense of duty and responsibility for the well-being of others is also a very high driver towards continuing to work while sick, as is a reluctance to let colleagues down too. So, it's definitely worth considering the drivers of presenteeism in your organisation. Also concerned about retention. We do know that there is a recruitment problem at the moment in health and social care, a national shortage, and the demand is expected to rise. So a very common reason for wishing to leave this type of work is stress and high workload, etc. Okay, next slide, please. Right, so what can we do about it? Now, I'm going to make various suggestions. Obviously, we don't have a huge amount of time, so I will just be taking a very superficial view, if you like. But if you do have any questions, please get in touch with me and I can help. So as we know, we need to take a multi-level approach. Organisations must have evidence-informed interventions at all levels, from the primary, where organisations tackle the sources of stress at source, secondary, where we build up individuals' ability to cope, and tertiary, where we're supporting individuals return to work. But unfortunately, most of the interventions tend to be bundled up in the secondary level. So we are expecting individuals to learn how to manage stress more effectively, if you like, counselling, etc., which is undoubtedly important. But we would certainly argue that many more interventions are needed at this primary level. So next slide, please. Apologies for the multicolour here, but it'll keep you awake, certainly over lunchtime. So we need to consider what works, and these are some suggestions that we have based on the evidence at primary, secondary and tertiary levels. Now, I know that Steve is going to be talking quite a lot about some interventions that are in place afterwards, so I won't be focusing that much on secondary, but I do really want to focus a lot on primary. Very important to have a whole organisation approach and promote a safe working environment that supports mental and physical health. Tackling stigma is obviously very, very important. And, I think we're all hoping really that the stigma that previously existed about speaking up about mental health problems will have reduced a lot following the pandemic, because people are much more likely to talk about it now. So hopefully that will remain. We need to assess risk, diagnose the hazards, possibly by using the Health and Safety Executives Management Standards. Now, for some of you who may not be aware, they have recently introduced a talking toolkit that goes alongside the Health and Safety Executive Management Standards, where you can have conversations with staff about that. The other thing that I did want to pick up is spotting signs of struggle. Now, this is absolutely vital, and certainly Ben mentioned a few things about that in his talk, but it can be much more difficult to do when people are working remotely. Certainly, things like, spotting extreme levels of distress where people, having crying fits, etc., or, angry outbursts, that's much more easy to spot. But it's a particular problem when people are working at home and when they're new starters. So colleagues and managers don't really know what's normal for them and the support that they need. And certainly I would recommend here that Mind have a really, really good wellness action plan based, targeted for people working at home. And that's really excellent for employees to identify the signs that they are likely to show if they're struggling. So that could be very useful. Presenteeism also is another issue that should be considered, and also change fatigue, which is endemic in healthcare. So it's spotting these issues. Secondary include things like psychoeducation, mindfulness, etc. Reflective groups like Schwartz rounds, very, very helpful indeed. Providing mental health tools and encouraging access. Now, what we found in our work, certainly the reviews and the primary research, was that people are often very unaware of what's available to them. So it's really important to have almost like a sort of one-stop shop where people can see what's available in one particular place. And also they need to be encouraged to use it. And senior leaders and managers should also role model this desired behavior and show that they are accessing help themselves, help and support themselves. Above all, ensuring interventions are evidence informed. That goes without saying, are appropriate and, as I said, are accessible. Tertiary, well, occupational health services have been very much used, I think, during the pandemic, and in some areas they can be under-resourced, and there is some concern that occupational health staff feel they lack knowledge and training on spotting and treating mental health issues and burnout amongst workers. So I'm going to be working on a project on that soon to upskill people in that particular area. Ensuring access to support, etc. Ensuring return to work is as smooth as possible. Now, this is going to be a particular issue when people are experiencing things like long COVID. And as we know, managers have a key role to play here. And also better communication between occupational health staff and managers working together to negotiate a return that's acceptable for everybody and adjustments that are likely to work. Okay, so that's just a very brief overview of what is likely to work, and I shall hand you back. Thank you.
Thank you, Gail. Gosh, there was a lot in there, wasn't there? We'll talk about some of that in the Q&A. Steve, over to you now. Thanks.
Okay, thank you. Good afternoon, everyone, and thanks very much for inviting us along to talk to you today, to share what we've got to really on our kind of health and wellbeing journey. So my name is Steve Lee. I'm on loan at the moment from Public Health England to NHS England and NHS Improvement. Before working in Public Health England, I've worked in a number of regulators, including the MHRA, who you'd have heard of in terms of licensing the vaccination. Before that, worked in a health and safety executive, developing the management standards on stress. If I could get the next slide, please. So I joined the team in October. At that time, we'd put in place a number of interventions to support staff at an individual level. So between April and October, a number of app developers and providers had come to us to offer their services. We'd created a devoted website. We'd created helplines with the support of the Samaritans and Hospice UK. And you can see there that the number of hits, the number of app downloads has been significant up to this point in time. Worth saying that those interventions, though, require an individual to decide what type of support they need at a given point in time, and there's no real feedback loop to the organisation. So that's something that we're moving towards shifting at this point in time. We've also provided coaching sessions for staff, specific support for BAME colleagues, and every time we put out an offer, they're oversubscribed, so that's something that there's clearly appetite for across the NHS. As well as that, to build on our inclusive health and wellbeing offer, we're ensuring that any physical wellbeing offers that we put forward are accessible to all. So at the moment we've got an initiative called 5K Our Way, so whether you cycle, whether you run, walk, it's entirely up to you how you participate. Working on that project with the Invictus Games Foundation, and that helps us in terms of being seen as not being instructional, so that we're working with partners to kind of encourage physical activity. In addition, and because of the ways of working at the moment, we've held webinars which have been, again, kind of oversubscribed, to share where we are, what support is available, and where we're going next on the journey. If I could get the next slide, please. We asked staff around, kind of what have been their barriers to accessing health and wellbeing support, and part of this kind of builds on some of the comments I made earlier around, time and staff potentially seeing some of the offers as being something they need to do in their own time. If you need to access an app, or if you need to access a helpline. Awareness. So while we've had a number of people accessing the website, using the apps, some people still don't know that the national offer exists and don't access it. Lack of trust, as you'll know, there's stigma particularly associated with mental health issues, and there's this kind of fear factor that if people do engage with some of the support services, that could go back to their line manager. Feelings of being too tired, too overwhelmed, not having the time to go, which goes back to that first point about to access the offers. This sense as well, and this is something that's a cultural issue within the NHS that we're keen to kind of overcome, is this the sense that kind of when you're the care provider, it's often challenging to seek help for yourself. So we're trying to normalise those help-seeking behaviours. Some issues around IT, some colleagues saying there's too much to navigate through, and others saying that they don't feel as though they need to access the support, or there aren't any barriers. So there's a whole host of things in the mix that helps us to kind of refine the offer and ensure that it resonates. So for example, some of the apps that we initially provided, we've started to sunset those because they weren't being accessed, or they weren't being used in the way that was intended. If I could get the next slide, please. In addition to kind of asking staff kind of qualitatively, we also kind of check in on a quantitative metrics using something called the Pulse survey, which has been underway since the pandemic struck. The key theme that I'll draw out of here in the light of time is that this reinforces something that we already know, that good support from line managers and from peers has almost a protective effect from things like too high demand or not enough control at work. Now, where does that evidence come from? Well, that comes from something called the Whitehall 2 study, a longitudinal study looking at the health of civil servants over time. And that showed this dynamic between kind of demands control and support at work, that support had that almost protective effect. So in some ways, it's kind of reassuring to get that reinforcement that support is essential in what we build going forwards. If I could get the next slide, please. And now this really kind of gets to the heart of what I wanted to share with you. So while it was absolutely the right thing to do when the pandemic struck to provide that support offer aimed and targeted individuals who needed that help, guidance and support, we're now starting to shift the emphasis, to shift the focus towards organisationally led preventive measures. So kind of those upstream activities that organisations can implement and own to yield downstream positive outputs. So what we're doing at the moment, and the priorities for the coming year, are to embed something called health and wellbeing guardians, senior leaders within organisations, both large and small, who can kind of oversee and champion health and wellbeing within organisations. So typically a health and wellbeing guardian in a large trust would be at non-executive director level. Within smaller primary care organisations, the organisation itself can decide who wants to fulfil that role, but it's somebody who can influence the health and wellbeing agenda. To help with that role, we've been working with colleagues within the Health and Safety Executive and the University of Manchester to develop indicator tools that guardians can use to help assess performance, and we're due to go live with a prototype tomorrow. And that tool is looking at both lead and lag indicators of health and wellbeing performance. I think typically within organisations, there's this default to look at those lag indicators, particularly around sickness absence and presenteeism. And sometimes that can drive the wrong types of intervention, because you're responding to an issue that by its nature has had a lag, that is kind of almost like a past issue. So we've asked HSE, and they've developed some that blended approach. So you can also see about what are those positive lead indicators that can provide you with assurance that you're taking steps in the right direction. So a lead indicator could be things like you've introduced stress management standards, you are complying with the violence reduction standards, for example. So that work is underway and it's moving at pace. And again, kind of in terms of developing those products and tools for guardians, it kind of encourages the guardian to ask the question, if they've got a higher than average sickness absence rate, is that okay? Bearing in mind that they're offsetting that with some of those preventive measures. The next tier down, so you've got that top level senior buy-in. The next level down is to equip line managers. And we've been asked when we've introduced this concept called health and wellbeing conversations, are we going to measure them? And our view is no. These should be ongoing, routine check-ins, that kind of how are you conversation. And that line managers, if they don't feel equipped to answer the question in immediate here and now, they know where to signpost for help and guidance, either for themselves or for a member of staff. But the important thing is the routine nature of those conversations. And I think it's worth saying on both the Guardians piece and on the health and wellbeing conversations piece, we recognise that health and wellbeing is on the agenda in a way that it's never been before. So we're really keen to ensure that the territory that we've gained, we retain, and that we keep kind of moving forward. The third element has got kind of two components really. The first is to continue to deploy evidence-based interventions on mental health. So we're currently mobilising 40 mental health hubs nationwide that staff can access to seek help, support and guidance if they have a mental health issue. And the second element is around occupational health. And this is the integrated occupational health work stream that's underway at the moment. Dr. Steve Borman, who some of you may be aware of, who are involved in occupational health, has provided recommendations to us to advance. And this is about building on some comments that we made earlier, how you get occupational health as part of that integrated health and wellbeing management system, as opposed to being seen as external to the organisation or somewhere where you go to respond to some of those lag indicators. How can occupational health help you? How can it gather intelligence? How can it help inform the guardians within organisations? How can it help equip line managers in teams to have those health and wellbeing conversations? So instead of being seen as kind of on occasion a passive function, it's very much an active function, and we're investing pretty heavily into making sure that happens over the course of the coming year. Against the backdrop of those three priorities, we need to ensure that everything that we're doing has a focus on people recovery. So Neil Greenberg, who you heard about a bit earlier, he sits on something called the Recovery Commission that's supporting us in our work around recovery. The strong message we're getting, the strong steer that we're getting is that one size doesn't fit all. So, our view is, any conversation around recovery has to start with that conversation, what's going to work in your given context. If I could get on the next slide, please. And just to finish, really, so that's our kind of strategy for the coming year. They're our priority areas of a firm focus on prevention. We continue to refine the offer, and we listen to staff. We've had great involvement from the Invictus Games Foundation. We've had great involvement from the Duke and Duchess of Cambridge around our bereavement support lines. But we also have extended access to our apps. So app providers have generously kind of allowed extensions to their services for us. We've got the physical health offer that I've mentioned. We've put in place some additional kind of external support to help colleagues with financial well-being and with relationships. Violence reduction training. So we've seen that there's been an increase in violent assault during kind of the pandemic. So what we've got now is a body-worn cameras project, particularly in the ambulance sector, but we intend to extend out further. And that's acting both as a deterrent, but also to help us secure prosecutions. And I think as well, it's really important to kind of reflect that, I think often people see violence as, perpetrator and victim. It has a much wider impact in terms of the impact on colleagues within organisations. I've mentioned about health and wellbeing conversations. I'll finish off on saying, kind of there's also work around that kind of those secondary interventions around, how do we equip line managers to support staff? How do we ensure that the right responses are received to those health and wellbeing conversations? And we'll continue to kind of listen and engage with the broad community to ensure that the offer is inclusive, looking at BAME colleagues, looking at the LGBT plus community, looking at colleagues with disabilities to ensure that all can participate. That was my final slide. Oh, sorry, my colleague on the analyst would kill me if I didn't say this, but everything that we do, we kind of review and we ensure that we kind of test, and we do get regular tracking to ensure that what we're putting out there resonates and is valued. Thank you for your time, and more than happy to answer any questions about where we've got to.
Thank you very much. So quite a few questions coming in, and I've got quite a few of my own, but I'll keep mine till the end if we've got time. The first question, Steve, seeing as you spoke last, this is a very practical question, but Lynn would like to know how you decided on the pulse survey questions, and what did you learn as to whether these were the right questions?
Yeah, with Pulse, it's an ongoing process. So we've got the ability to include or kind of exclude questions. So it's been, I wasn't involved in the initial kind of rollout of Pulse because that happened kind of in April before I joined the organisation. But what I can say is that it's enabled us to kind of test in real time metrics that we're interested in. So I mentioned those health and wellbeing conversations. We're now tracking to see the uptake of those, not in an intrusive way, but just to kind of test what's happening as a result of that initiative. Is it gaining traction or isn't it? And there'll be other questions that we've started to kind of sunset. So it gives you, the advantage for us is that it gives us a more real-time feel of the data. It enables us to be more responsive as opposed to just relying on the once a year staff survey, which by the time you've had the results, by the time you've developed your interventions, you're kind of 6 months behind the curve. So that's been the advantage of it. I could ask colleagues about, kind of what kind of the initial decisions were around, the original items, but in terms of practical use, that's how we test and refine.
Thank you. Thanks. Which, Gail, I wonder if you'd like to take this one. How can you measure presenteeism?
That's a really good question, because obviously it's much easier to measure absenteeism, isn't it? Because somebody's either there and working or they're not, they're signed off sick or they're not. And indeed, if a worker turns up for work and says that they feel too sick to work, an employer would be contravening their duty of care, wouldn't they, if they allow them to continue? So it's incredibly difficult in any other way but self-report in staff surveys, including questions on presenteeism, not just, how many times over the last year have you worked while sick, but the type of illnesses perhaps that people are most likely to experience. And I really think that the CIPD's approach is excellent too, where you're asking people, professionals, to actually report on the extent to which it is a problem in their organisation. But it's a very imprecise art at the moment. There are some scales to measure it, but I think it's definitely a work in progress.
Thank you, Gail. I've rolled a few questions to get that together here. Ben, can I throw this one at you? You and Gail both spoke about made reference to spotting the signs. And there's two elements here, isn't there? There's the competence of line managers to recognise the signs, and then there's the confidence of those line managers to start those conversations. We've already had the Mind resources popped into the chat box so people can access those. Are there any specific CIPD resources to help line managers get those tips and skills to start those difficult conversations? And also around that resource question, is there anywhere people can go to source a reputable and recommended occupational health provider?
I mean, on the first point, again, I'd probably come back initially to the sort of the core people management competencies I was talking about, because you know, when you start to have regular conversations, you know, with people in your team, you know, and get to know them, and you know, those sorts of discussions tend to arise much more organically and naturally. So I think the critical thing is for managers to really understand the people they manage through investing time in their one-to-ones, to developing their soft skills around empathy, listening, and providing flexibility and support. And it's only from those behaviors that you then to get trust. And I mean, of course, you need to be able to recognize, you know, some people will be, you know, will hide and might not want to disclose, and you need to be able to sort of, you know, pick up on those sort of triggers which might suggest someone is you know, struggling. But then the key is to ask the sort of open questions, because you can't force people to talk about these issues. They need to feel confident that they want to disclose, and it's the sort of management behavior piece which is critical. So I think if the challenge is this is quite a complex area. There's no a switch that you can flick, or you know, sort of intervention that will guarantee you know, people's health and well-being. It is about behavior, and it's about, a lot of it is about the soft skills of line managers. And I think we just need to invest much more on proactively developing those skills, and particularly if you look at, you know, within you know, for example, I mean, Steve, I suppose big issue is in the NHS, you know, the people management skills of clinical leaders. You know, we've got to make sure that those skills become, if you're managing people, those skills become absolutely core to your role as a manager.
Thank you, Ben. Steve, going back to your case study, we've had a question around the support that exists under the different headers that you mentioned at that high level. So, for example, tapping, trauma therapy, breathing. What types of support are you actually offering?
Well, there's a whole host that staff can access, dependent on what their needs are, really. So you know, from a manager level, they can access a whole host of learning and development around health and well-being. An individual level, I mentioned the mental health hubs. You can access a whole host of apps, for example, Headspace, Daylight, Sleepio. You can access the support lines that we've got that are run by the Samaritans. You can access their website, which takes you to financial advice and support and guidance. We've started a partnership with Relate as well, so for relationship issues. So depending on what staff need, there's an avenue for them to pursue. And just to quickly respond to I think a really good point made by Ben, in terms of, we're keen to ensure that there isn't a lottery in terms of what management response and what support you receive at work. So getting consistency is really, really key. And I don't think health and wellbeing should be seen as just an isolated activity. You've got to factor in as part of kind of the employee journey. You've got to think about what your freedom to speak up arrangements are, so that people can recognise and call out when something isn't going quite right. So for me, it's part of weaving what we're trying to do on health and wellbeing as part of a much bigger organizational culture piece. So, you know, I'm trying to think of it much more of what can you expect onboarding, what can you expect when you're at work, you know, through support, through your line manager response, and why are folk leaving. And understanding those elements, I think, is really key for us.
Thanks. I'm just following on from that then, Steve. Obviously, there's such a wealth of resources available to your 1.3 million people. I guess I'm interested in how you effectively signpost all of that. in the context of, you know, pandemic, frontline workers, so that the information they need is available to them in the moment at that very point of need.
Yeah, and that's a really tough one. It's a really tough nut to crack. So you can use things like the website, you can do that, but we need to think of other mechanisms too. So engaging with other partners, trade unions, for example, people in the occupational health teams, people who are in the organisations who can help us cascade, but it's got to be relevant. And the message that rings in my ears whenever I'm kind of pursuing this is from Dr. Paul Litchfield, who heads up the Work Centre for Wellbeing, who says you've got to keep this simple. So it's got to be applicable and relevant wherever you work. So we're working on, you can't, you know, one size doesn't fit all when it comes to communication. So that's something that we work on kind of relentlessly, you know, thinking about who are the other communications channels. You know, can you use TV screens, for example, in trusts or within doctors' surgeries to get those kind of messages out to people? Whatever it takes, we'll try and do. We've created credit card size kind of documents that people can use. We've used A5 document. We've used a whole host, a whole raft. There'll always be gaps, but we're trying to use both the digital offer combined with more traditional routes to ensure that everyone from a senior consultant through the whole organisation knows how to access the support in the here and now. The key thing, though, that we've got to balance is that the default response to health and wellbeing issues isn't go to this app, go to this website, go to this helpline. It is, how can I help you in a line manager capacity, and how can we make an organisational shift that can help you in the long run? That's how I believe you're going to make a sustainable and substantial difference.
Great, thank you. So the CIPD resources, there's a link just been posted in the chat if you've missed that, to help you go directly to the resources that we've got available. Gail, sorry, somebody's asked Jill a question, but Gail, could you give some examples of tools that could be used for managers who feel uncomfortable discussing mental health issues for personal reasons? And just before you answer that, Gail, could I just ask the panelists to pop into the chat their contact details? I'm sure people are going to want to follow up. Steve, in particular, that question around the Pulse survey, and Gail, I should imagine there'll be plenty of queries around some of those interventions that you shared with us earlier on. So if you could just do that in the last few minutes, and then Gail, maybe give us one or two examples of the tools that we can use.
Right. Now, I am aware that many managers do feel embarrassed and find it very difficult to discuss this issue, and also many individuals do too. So putting the two things together, it can be rather challenging. I'm not personally aware, to be honest, of any tools that are available. Ben, is there anything in CIPD that can be helpful there?
I mean, we have our guide with the joint guide with Mind, which I think is useful. One thing I would say on this, I think return to work interviews can be really helpful ways of having these conversations. The Royal Mail used to have a fantastic e-learning resource where they had a video of a line manager going through a return to work interview, and they ran it twice. First of all, it was a depot manager doing a return to work interview with a postie, and the first time the manager goes through the return to work questions, and he asks all the right questions, and they decide that the postie is going to return to work on a given date. Then they run it again, and this time the manager is using those sort of soft people management skills. He's listening properly, engaging, asking follow-up questions, and the whole conversation changes to one where the postie then starts sort of opening up about the issues that's happening in his home life, why he's been having to take time off, and then they have this conversation about, well, how can we resolve it? What sort of flexibility might give you a bit of space to help to manage these issues? And I think those sorts of tools that give real life examples of how you can change the conversation, how you can make it much more human centered, and how you both as a manager and the individual get much more out of it. I think you've got to bring the conversations to life, because it's not rocket science. It's just about deploying those soft skills and using your common sense, and asking open questions. I think those sorts of tools can be quite helpful.
Absolutely, and it's taking an individual approach, isn't it, rather than having a list of questions to tick. And because certainly in my own research, I'm very aware that some people can find return to work interviews when they've had mental health issues very intimidating and are rather concerned about them. So having this developmental approach, you know, where there can be conversations, if you like, would be, and risk assessments also would be very useful.
Thank you. Thanks, everybody. Time is up, so we're going to have to leave it there. As usual, more questions than time. We have tried to get through as many as we can. Thank you to Gail and Steve and Ben, who I'm sure everybody will agree have shared some really great insight with us, knowledge and expertise. I think for me, one of the things that's come through loud and clear is there's just so many aspects to the whole issue of mental health in the workplace, and there's new dimensions and potential contributors to the issues emerging all the time. You know, we've read quite recently about a new COVID anxiety around people who've been working from home or shielding or on furlough, actually experiencing real anxiety now at the prospect of even going outside their house. And that, you know, that is a real issue and a real contributor to their stress levels. There's also the tensions through, I guess, people returning with different experiences, and the impact of returning back to work and how you sort of manage and balance the experience of the frontline workers with the experience of people who haven't had the same experience. Obviously, they've had their own very different experience, but it's matching those up. Thank you to everybody who's submitted a question. Thank you to the person who's submitted an idea for a future session. We'll certainly pick up on that. The recording is going to be available on demand, as will the slide deck. And just a final reminder, it's just so relevant to what we've been talking about today, of the wellbeing support for members, our CIPD members in the UK and Ireland, the 24/7 telephone helpline, staffed by therapists, and which is all provided by workplace wellbeing provider Health Assured. So thank you everybody for joining us. See you next time.